Our region's business is sponsored by PNC Bank, solutions that help you achieve your goals in life. PNC, leading the way. And by Heffron Tillotson, a history of meticulous wealth management since 1948. Our region's business, innovation, transformation, momentum, improving our communities and driving technologies that will shape our region for generations. The collaboration that brings vitality, prosperity, and life to living. Stay with us for the coming half hour as we examine in depth our region's business. Now, here's your host, Bill Flanagan.
Today on Our Region's Business, your company may be eligible for a portion of billions in unclaimed tax credits. We'll explain why they're overlooked and how you can cash in. Plus, a tasty Pittsburgh institution turns 50. We'll see what's been keeping them rolling in the dough for half a century. But first, a turnaround at a local healthcare system has been turning heads nationwide. Heritage Valley Health System operates 2 hospitals in our region, in Beaver and Swickley. Over the course of this decade, the company has fine-tuned its operations to get into the black, a strategy that has relied in part on partnerships with other healthcare providers in our region. Last summer, Thomson Reuters rated Heritage Valley as one of the most improved healthcare systems nationwide over the past 5 years. Norman Mitry is president and CEO of Heritage Valley Health System, and welcome. Good to see you.
Thank you, Bill. Thanks for having me here today.
Congratulations, too. You know,
Well,
you always hear about the stressed healthcare industry. It's nice you've been able to reduce your stress a little bit.
Well, it's worked out well for us, Bill. We, back in 1996 is when our board and the Swickley board and the Beaver board said we wanted to build an independent integrated delivery system to be locally owned and controlled. And that's really when Heritage Valley got its start in 1996. And it has grown over the past 12 years. And frankly, here on November 1st of 2008, we had our 12th year birthday. So we're into our 13th year.
And that's amazing. Late 90s, it looked like everybody was getting snapped up. In those days, it was, it was AHRF, it was UPMC, but into these Goliath healthcare systems. Why the sense out in Beaver at the time that it made sense to create an independent system?
Well, I think both the board of Swickley and the board of Beaver did not want to be controlled by someone in the city. They wanted to make sure folks in the community still sat on the board and had a voice in healthcare. We believe, and our board believes, that healthcare is local, and that in fact individuals want to be close to their primary care physicians, want to be close to their hospitals. Both the Swickley campus and the Beaver campus still deliver babies. We deliver about 2,000 babies a year. And if you think about Western Pennsylvania, very few of us in the community healthcare system still do that. So having that control, having that autonomy, not being overshadowed by a big corporate parent is really what the boards wanted.
And at a time that's challenging, that whole period over the last 12 years for a lot of healthcare systems. So what really do you think has made the difference in terms of being able to turn this into a profitable business?
Our success has really been our medical staff. We are clearly a physician-led organization. When we started building this integrated delivery system, we knew it was all about physicians. It was all about primary care physicians, because that's who the patients really select. They don't really select the hospital. We often say that physicians are the only ones who can admit, discharge, and write orders. We're overhead. We have big buildings, we have nurses, we have staff, we have administrators, so we're viewed as overhead. If the physicians can't provide high quality health care in a local setting, then they will recommend that their patients go elsewhere and they'll practice elsewhere. So our focus for all these years has been focused on our medical staff, build our medical staff, and frankly offer a high quality customer service product around healthcare, both prevention and the treatment of disease. And that's what the board has really directed us to do for the past 12 years.
And in an economy in Pittsburgh as a whole, where we've kind of lagged the national average in so many ways, but you've managed to fill the beds and keep the business viable throughout all this.
And a lot of that is through some strong relationships. For example, the Beaver campus of Heritage Valley has been doing cardiovascular surgery since 1994. It was one of the first community-based hospitals to start doing open heart surgery. And frankly, it was started by Allegheny General back in '94 doing open heart surgery down in Beaver, and it has evolved into a Heritage Valley cardiovascular program. The Swickley campus, we have a very advanced center of excellence around bariatric surgery and around orthopedic excellence, also for the orthopedic surgery. So having the high quality physicians and being able to provide other high quality care around that really has the patients who keep coming back to you.
That's interesting. I was also intrigued, though. It's not like it's a knockdown, drag-out fight with the other health systems. You've found ways to partner with them as well along the way.
Yeah, we have. One of our key words that our board has us focused on is relationships. And we believe that you should not spend redundant capital if you don't need to. So, for example, we have a great joint venture with UPMC for 2 regional cancer centers, one in Moon Township, one in Beaver. So people who have the unfortunate experience of having cancer, they don't need to travel to Oakland for radiation therapy. There's medical oncology and radiation therapy oncology available on both campuses. High-end, state-of-the-art equipment, state-of-the-art care, provided in a very local community setting, so they don't have to travel. If they're in Beaver, they don't have to travel that 30 miles, 35 miles into Oakland. If they're in the Swickley area, they don't need to travel that 15, 20 miles into Oakland.
And then it really ties back to both health systems, so you each win in that.
It does.
In
it
that
does.
circumstance.
Exactly.
So, you know, a great track record over the last 12 years. As you look at the current environment, how are you holding up as the economy begins to soften?
Well, the economy clearly has its impact on healthcare. You know, if you think about health plans and insurances, individuals have many more levels of copay and deductibles. And as families struggle, whether it's gasoline or heating or to put food on the table or that of college tuition, sometimes some of the elective surgeries will take a back seat. Sometimes some of the needed therapy services after you have a joint replaced, whether it's a hip or a knee, or even have an open heart surgery, you require therapy, whether it's cardiac rehab or physical therapy. And along with those services under most health plans comes a copay and deductible, which if cash is short, people tend not to follow up at the level they should. So it does have an impact.
Cuts into your revenue, but it's actually probably cutting into their ability to have a recovery and good, strong health as a result of the procedures.
Absolutely. Absolutely. It does do that.
So it's just a reality, though, I guess, of the economic times.
Well, it's really something you have to keep educating the patient population about. So when they have the joint replacement or the open heart surgery, the nurses and the discharge planners spend time with the patients, educating them about how important the physical therapy or cardiac rehab really is. So the joint they had replaced or the bypass surgery, they can go on to the next level of improved health.
Well, something really to think about, because in the long run it winds up being more costly for all of us if they don't do it.
It does. Absolutely does.
Well, congratulations on a great 12 years at Heritage Valley.
Well, thank you very much.
Appreciate it, man.
Okay.
Good to see you.
Thank you.
Up next, what's in a name? We'll show you how billions of tax credits go unclaimed, tax credits that your company may qualify for through everyday procedures, but you may never have realized it because of the tax credits' confusing names. We'll explain in just a few minutes. Stick around.